The idea of compulsory insurance of workers in Russia appeared in 1889 with the submission of the draft law to the State Council on responsibility of industrial enterprises owners for severe injury and death of workers. 14 years later, on June 2, 1903, the first of the most significant legislative acts was adopted, regulating the relations of workers and their employers. The law adopted in 1903 introduced not only mandatory insurance of workers, but also contained a number of articles which were of great importance for the establishment of state social insurance in Russia. The first post-revolution provision about Social Security of employees was adopted in 1918. It guaranteed all employees allowances in case of temporary loss of income due to illness, pregnancy and childbirth, or severe injury. In 1929, the state's social insurance obtained a single budget, and beginning in 1931, social insurance funds were used to finance sanatorium resort treatment facilities and children's recreation camps. In 1933, after a number of reorganizations of the system, all basic social insurance funds were placed under the oversight of the All-Union Central Council of Trade Unions and the Trade Unions Central Committee. Such a structure, in which the influence of the trade unions was predominant, remained until the onset of reforms in the 1990s. In the context of market reforms at the beginning of the 90s, it was necessary to separate the state social insurance funds from the state budget and corporate funds. That's why on January 1, 1991, the Social Insurance Fund of the Russian Federation was established as a non-budgetary fund by the resolution of the Russian Soviet Republic's Council of Ministers and the Federation of Independent Trade Unions. In 1992, by decree of the President of the Russian Federation, the fund was taken out of the jurisdiction of the trade unions and recast as an independent state finance and credit institution with its own budget. In the years to follow, these were the heads of the fund: Natalia Malakhatkina, Yuri Shatirenko, Yuri Kosarev, Galina Karyelova, and Sergei Kalashnikov. Today, 83 regional subdivisions and 395 branches in all constituent territories of the Russian Federation form the organizational structure of the fund. More than 1,500 authorized agents carry out work with the insured. The fund's executive bodies and authorized agents service more than 5 million organizations, employing more than 60 million people. The fund and its executive bodies employ about 30,000 people. The central administration of the fund includes 10 departments: finance, law, budget, insurance premiums administration, professional risks insurance, social programs and analytical assessments, informatization, organizational and personnel work, and 3 management departments. The fund provides 2 kinds of compulsory social insurance. These are insurance in case of temporary disability or maternity leave. Within the framework of this kind of insurance, we pay approximately 30 million sick leave certificates annually, in addition to maternity allowances for more than 1 million women, and monthly allowances for childcare for the first year and a half. Another kind of mandatory social insurance, workplace accident and work-related illness coverage, includes payments to almost 500,000 people. We also provide coverage for medical, social, and professional rehabilitation. In addition to that, in the framework of this kind of insurance, we finance measures to reduce job-related risk and injuries in the workplace. According to the fund's data, more than 7 million people in the Russian Federation currently work under hazardous and dangerous labor conditions. Since 2001, the Social Insurance Fund of the Russian Federation has been allocating up to 20% of insurance contributions to the financing of preventative measures for the reduction of injuries at production sites and job-related illnesses among employees. For the period from 2001 to 2009, the costs for these purposes amounted to more than 20 billion rubles. In this kind of insurance, we've seen considerable achievements, thanks to both our measures and the measures taken by employers to improve labor conditions. So over the period from 2002 to 2009, the number of annual accidents at production sites fell from 135,000 to 71,000. In total, over 7 years, this means that 250,000 Russian citizens were spared from workplace illness and injury and instead continue to earn a living for their families. The fund pays great attention to the improvement of rehabilitation for those injured. The costs of this work are paid by insurers, and over 10 years they totaled more than 23 billion rubles. 12 rehabilitation centers of the Social Insurance Fund of the Russian Federation carry out complex rehabilitation of people whose health was damaged by work-related accidents and diseases. The application of progressive medical technologies in combination with unique natural spa treatments allows many patients not only to restore their health, but also to get back to full-fledged working livelihoods. Compulsory social insurance is part of the state system for the social protection of the population, based on the insurance of working citizens against possible changes in material or social well-being, including changes due to circumstances beyond their control. In case of illness, attending medical specialists at clinics are authorized to issue official doctor's exemptions, entitling the recipient to compensation from the resources of the Social Insurance Fund of the Russian Federation. Maternity leave and work-related illness or injury are cases known as insurance risks, which are also due to be compensated by the fund. Currently, the fund provides for the operation of a multi-level system of state social insurance in the country, and participates in the implementation of the government's social policy. Making payments on 2 kinds of compulsory social insurance, the fund performs a number of functions within the framework of federal programs. The fund distributes medical aid to bearers of birth certificates to cover women during their pregnancy and postnatal period, as well as infant health care. The fund also provides special needs citizens with sanatorium and resort treatment and provides the disabled with technical means for rehabilitation. The process of transferring these authorities to constituent territories of the Russian Federation began in 2009. The fund's Audit and Supervisory Division controls the financial and economic activity of budgetary expenditures by territorial bodies and, if need be, by branches of subdivisions and organizations furnished from the fund's budget. The fund has created and operates the Unified Integrated Information System, known as soцstrах. It provides for the receipt and processing of data from the 5 million insured. The system contains the data about more than 500,000 recipients of compensation for work-related accidents and illnesses, information about more than 15 million citizens categorized with special needs, data about distribution of recreation vouchers and transportation coupons, data on the provision of rehabilitative equipment for the disabled and specially categorized veterans, information about the movement of birth certificates, and more. The search and monitoring system provides services for ministries and agencies cooperating with the fund, as well as for organizations manufacturing rehabilitative equipment, for organizations providing sanatorium and resort treatment vouchers to specially designated categories of citizens, for maternity hospitals and prenatal clinics where services are paid in accordance with issued birth certificates, and for all insured. From January 2010, receipt of settlements from the insured is carried out in accordance with Form 4 of the Russian Federation Social Insurance Fund in electronic format with electronic digital signature via the Internet. In order to solve the tasks of insurance payments administration, the fund's executive bodies carry out registration and recording of the insured, recording and systematic monitoring of the receipt of contributions, and organization of interdepartmental interaction. For the purposes of informing Russian citizens and employers about their rights and obligations, the fund publishes and disseminates brochures, booklets, posters, and leaflets. The fund's territorial entities organize the broadcasting of stories on local television and radio, as well as publications in newspapers and magazines, explaining citizens' rights and the procedure in the event of various insured accidents. The insurance edition's Social World and the newsletter of the state social insurance are issued on a regular basis. The fund cooperates with public organizations, carrying out scientific research and educational work. A great volume of information is available on the fund's website, and the websites of its regional subdivisions. In the next 3 years, the fund is to become a valuable insurer and to make direct payment of temporary disability and maternity allowances to Russian citizens. This will protect workers from the risk of employer insolvency when an employee might fail to receive not only their salary in a timely fashion, but also their insurance coverage as well. We will have to seriously modernize the insurance system for workplace accidents and job-related illnesses. This system must become an effective instrument for reducing professional risks, particularly in hazardous and dangerous labor conditions. The system of rehabilitation for employees injured on the job must be considerably improved, primarily with regards to counseling, retraining, and placement in new jobs for people whose injuries limit their ability to work. If the Social Insurance Fund has a mission, it's to minimize the negative impact on citizens of temporary or partial loss of their ability to work, and the fastest possible return of citizens to active employment, which has been and will continue to be the main source of income for millions of Russian families.